Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ascariasis is an infection of the intestines caused by a type of parasitic roundworm. These roundworms can grow quite large, sometimes reaching up to 14 inches in length, and can cause a variety of symptoms depending on the severity of the infection. Roundworms are worms that are shaped like long, thin cylinders. They are part of a larger group of parasites that can infect various parts of the body, but in the case of Ascariasis, they primarily target the intestines. The species of roundworm that causes Ascariasis is called Ascaris lumbricoides, and it's the most common roundworm infection in humans. This species has a complex life cycle that involves both the human host and the environment. Ascariasis is most common in places without modern sanitation. In these areas, the lack of proper waste disposal systems allows the roundworm eggs to thrive in the soil, increasing the risk of infection. This is because people may come into contact with soil contaminated by human feces that contain roundworm eggs. These eggs can survive in the soil for years, making it easy for them to be ingested accidentally. Children are particularly susceptible to Ascariasis. Their natural curiosity and tendency to play in the dirt put them at higher risk of coming into contact with contaminated soil. This is because they may play in the dirt and then put their hands in their mouths without washing them properly. Teaching children good hygiene practices is crucial in preventing the spread of this infection. While Ascariasis is rarely fatal, it can lead to serious complications if left untreated, particularly in children. These complications can include malnutrition, growth delays, and even intestinal blockages, which require medical intervention. Ascariasis is caused by the ingestion of microscopic Ascaris lumbricoides eggs, which are often found in contaminated soil and water sources. These eggs are incredibly resilient and can survive in soil for extended periods, even in harsh conditions. They can withstand extreme temperatures and remain viable for years, waiting for a host. The most common route of infection is through contaminated soil. This soil can be found in agricultural fields, playgrounds, and even backyards, making it easy for people to come into contact with the eggs. This can happen when people walk barefoot on contaminated ground, or when children play in dirt and then touch their mouths or food. Children are particularly at risk due to their tendency to put their hands and objects in their mouths. Consuming fruits or vegetables that have not been washed properly, especially those grown in areas where human feces is used as fertilizer, can also lead to infection. Proper washing and cooking of produce are essential to prevent ingestion of these eggs. Once inside the body, the eggs hatch into larvae in the intestines. The larvae then begin their journey through the body, causing various symptoms and complications. These larvae then burrow through the intestinal wall and enter the bloodstream, eventually reaching the lungs. From the lungs, they travel up the respiratory tract to the throat, where they are swallowed and return to the intestines to mature into adult worms. Many people with Ascariasis experience no symptoms, especially if the infection is mild. However, as the number of worms in the intestines increases, noticeable symptoms may start to appear. In the early stages, when the larvae are migrating through the lungs, symptoms may include a persistent cough, shortness of breath, or wheezing. As the adult worms mature in the intestines, they can cause a range of digestive issues. These may include abdominal pain, nausea, vomiting, diarrhea, and loss of appetite. In severe cases, a large number of worms can cause a blockage in the intestines, leading to severe abdominal pain, constipation, and vomiting. Section 4. Diagnosis and treatment of Ascariasis. Diagnosing Ascariasis typically involves identifying the presence of eggs or adult worms. A stool sample is often the most effective method, as the eggs are shed in the feces. Doctors may also use imaging tests such as X-rays, ultrasounds, or CT scans to visualize the adult worms in the intestines or lungs. Fortunately, Ascariasis is treatable with medication. Antiparasitic drugs are highly effective in killing the adult worms. These medications are usually taken for a short period, and your doctor will determine the appropriate dosage and duration based on the severity of the infection. Section 5. Preventing Ascariasis. Preventing Ascariasis primarily involves breaking the cycle of infection and reducing exposure to the eggs. Proper sanitation is paramount. This means ensuring that human waste is managed correctly and does not contaminate the environment. This includes using toilets for defecation and ensuring that human feces is disposed of safely and hygienically. It's important to maintain clean and functional toilet facilities, especially in rural and underdeveloped areas. Washing hands thoroughly with soap and water, especially after using the toilet, before handling food, and after contact with soil or animals, is crucial. Hand hygiene is one of the simplest yet most effective ways to prevent the spread of infections. When traveling to areas with poor sanitation, it's essential to be cautious about food and water safety. Avoid consuming raw or undercooked foods, and be wary of street food that may not be prepared under hygienic conditions. Always peel fruits and vegetables yourself, and ensure that any water you drink is bottled or boiled. This simple practice can prevent ingesting contaminated food or water, which is a common source of infection. By following these simple precautions, you can significantly reduce your risk of contracting Ascariasis. Remember, maintaining good hygiene and sanitation practices is key to preventing many other infections as well.